Half a day, I'm Clare Calvo bringing you your daily renewal. Today I'm here at Larkin Family Chiropractic with Dr. Scott Larkin. Thank you for inviting us in today, Doctor.
Absolutely, Claire.
So we wanted to focus on primarily, because when people hear chiropractic care or chiropractor, they think of the actual, like, oh, so did you get into an accident, or if it's something like structural. Mm-hmm. And I wanted to touch a little more on the holistic idea of the different therapies that you use. Okay. Can you explain a little to us?
Well, I think you're accurate. As a chiropractor, our primary focus is to look, is there something out of position structurally, mechanically, if you will. If the joint is actually pinching or irritating the nerve, what we do is we look to see if that's present, we realign that. But in addition, you mentioned a trauma like an accident. The soft tissue can be damaged as well, the tissue that's designed to hold the joints in the right position. So what we want to do is realign it and do what we can to help with the soft tissue or promote healing in the area. Some people might think of heat, ice, things like that. Now there's also, chiropractors will have lasers, and lasers, for example, stimulate the body's own healing response. Almost like photosynthesis, the sun affecting leaves. It penetrates into the cellular level, it works on the mitochondria, and basically causes a chemical reaction that stimulates and speeds up the healing process of the tissue. So that's used quite often, even by acupuncturists for, instead of needles, they'll stimulate the points instead of stimulating with a needle now. You can use the laser to stimulate that same point.
Wow.
And really, Claire, an important thing to understand for a lot of people is we want to know why. If you come in with pain, say for example, you go in with a toothache to a dentist with some pain in your tooth, they say, you want that fixed? They write you some prescription for Motrin and say, have a nice day. You'd be like, right? You're there to get the tooth fixed.
Get to the root of the problem.
And so you fix the tooth and you fix the cause of the pain. The pain is not the problem, the hole in the tooth is. And so we'll go into the cause of the cause so we can fix it, but we also want to address what brought it on in the first place.
So before we close, is there anything else you'd like to share with our viewers?
You know, I really think as far as a physician, our job is really to love a patient. And to love somebody means to do your very best. And so it's a nice thing for a physician to be able to have that time to sit there and really care for the person, listen to the problem, that's really important, the history. Secondarily is to treat whatever it is and whatever means you have, as long as it doesn't have side effects and things like that.
Right.
And maybe it takes a teamwork approach. And then lastly, teach them. Bring them in on it. It's not a passive thing, this is we work together.
Right,
so that's very important.
Thank you so much, Doctor.
You're welcome.
Thank you for your excellent care as well.
Absolutely.
And thank you. I'll see you next time on your Daily Renewal.